Good evening, everyone. Welcome to the Christ Emmanuel Christian Fellowship Wellness Wednesday. We are so very, very glad that you are able to join us. We have a most relevant topic tonight. We are talking about kids going back to school and COVID, and how do we take care of our children. And we've got some statistics as to what's going on in Hamilton County. We have educators who can talk about ways that we can make sure that our kids are up to date. And so it's a very, very fine broadcast that we have for you this evening. So we hope that you are well. And we see that Linda Neal is watching. And what is COVID? And we've heard so much about it. And I'm sure we thought that we would be in a different place by now than we were last year. However, our children really need our protection. And also, there will be ways that we can keep you uplifted and encouraged as to how this is going to be done and how we're going to be safe. Good evening, Kim Thompson and Diane Price. We're so very glad to hear you and see you. And we hope that more parents will join us, not only from Christ Emmanuel, but from anywhere in the city. So let's talk in the minute to the Lord. Father, we thank you for this evening. We thank you, Lord, for these wonderfully gifted and trained and talented people who have given their lives to service, God, of the service to others, service to healing, service to wellness, service to education and uplifting. So, Father, we thank you, Lord, for their talents and gifts. And we thank you, Lord, that they are willing to share. We thank you, Lord, for the parents and the children even who may be watching, and ways that we can keep your people uplifted and give you glory in the name of Jesus. Amen. We're going to turn it over to Dr. Emmanuel, and he's going to introduce everyone who's on, all of our distinguished guests who are on the panel tonight. And I'm going to slip out and say thank you very much.
All right. Thanks, Pastor Carol, and good evening, everyone. As she said, I'm Dr. Emmanuel Chandler. I am a pediatrician and adolescent medicine physician here in Cincinnati, and also a member of the Health, Wellness, and Lifestyle Ministry here at Christ Emmanuel. So we're super excited to have all of you here. We have an amazing group of panelists who are joining us tonight. And Dr. Bolden is going to be moderating our discussion tonight and also giving her expertise throughout this conversation. But let's start off with Ms. Lauderdale, Yolanda Lauderdale, introducing herself, and then we'll kind of go from there.
Good evening. I am Yolanda Lauderdale. I am a public school educator teaching middle and high school.
I'm Felicia Kelly. I am also a public school educator. I teach high school only.
I am Leslie Christian, and I am a public educator with for middle school and high school, and also extracurricular outside of the school system.
Okay, and I am Stephanie Bolden. I am one of the facilitators for the Health and Wellness Ministry at Christ Emmanuel. I'm also a registered nurse. I work in a hospital setting, but I'm also an assistant professor of nursing at Mount St. Joseph University. And I'll be moderating this live tonight.
All right. So thanks, everyone, for that introduction. We're glad you're here. I'm first going to start off just with some background information around COVID-19 and where we are right now. So I think many of you know that we've been in this pandemic for about 18 months now. And COVID started back in March, and COVID stands for coronavirus or coronavirus disease. So we all are very familiar with that by now. But what we've seen recently is we have seen the development of many different variants. And right now what we're seeing is the Delta variant. That many of you are well aware of, and that is the variant that's causing the majority of infections across the country and across the world right now. So for a while, we were doing really well. We released the vaccines. People were getting vaccinated. CDC allowed us to take our mask off. We were vaccinated. And then we started to see the development of this variant. And we started to see in kind of middle of June into July an increase in infections across the world, across the country. This variant did first raise its head in India and then kind of made its way across the world. So bring it home to us in Hamilton County. So right now we are starting to see an increase in infections across Hamilton County. So in Ohio in general, we had the largest number of cases last weekend with about over 3,000 cases in a day, which is quite a bit of cases that we've seen since the summer, or since actually probably the winter time. And then in Hamilton County, we are also seeing that increase in infections within our hospitals. So our hospitals are starting to feel once again the brink of the people coming in with infections who are having to be hospitalized with COVID-19. So beds are filling up, ICUs are filling up, and patients are going back on ventilators. And unfortunately, we're starting to see an increase in deaths also. So it's really important that we're having this conversation tonight. Most importantly, what we're starting to see also is an increase in infection or incidence with children and adolescents. So at the beginning of this pandemic, the virus, of course, was affecting young people, but we didn't see it as much, right? So back in the end of June, according to the AAP, the American Academy of Pediatrics, we were only having about 30,000 cases of infections in children and adolescents at the end of June. Just last week, we had 180,000 cases of infections in children and adolescents. That's a 22% of the infections in our country were children and adolescents, and that's a huge increase than we've ever seen before. There's concerns about that this virus is the variant in general is more infectious, and we know that it's more transmissible than the original variant. And then it's also affecting kids and teens more. And so now we're thinking about going back into schools and how would that affect schools in general, the rest of the school year. And that's what we want to talk about tonight. How can we keep your kids safe, the teachers safe, the students safe, and also be back in school, because we know it's important for students to be in school, to learn, not just for educational reasons, but also for social reasons, for psychological development, mental health. It's really important for them to be in school. So our goal tonight is to talk about the safety of what you can do as parents to keep your kids safe, but also what schools are doing and what teachers are doing to keep your kids safe when they're in school. So Stephanie, I'll turn it over to you.
Okay, well, thank you so much for all of that information. That kind of sets the ground as to why we're here for tonight's discussion, which, like Dr. Chandler said, the most surprising facts is that our kids, our children, are being affected by this variant of COVID, which, the schools are just, starting to resume, which, kids, they need to be in school, right? They need that instruction. However, our big question is, how are we going to provide that level of instruction that's going to be safest for our children? And so we do have a panel of teachers here in the public school system, and they're going to be given some of their ideas as far as how they're keeping their classrooms safe, how are they staying safe themselves, because that is going to be the most important thing. Like Dr. Chandler said, the numbers are going up. Working in the hospital setting and seeing where the numbers were close to almost no patients on the COVID unit, the numbers have tripled, some even quadrupled. Our ICUs are filling up. Patients are waiting now again in the hallways in the emergency room. So we kind of expected this. We kind of expected this resurge. We knew there were going to be, once people were starting to get vaccinated, we knew that there was going to be some type of variant that was going to develop, right? But it's just happening so fast. It's happening so fast. We're back to work. I know I'm a nursing professor. We started back this week in person, and I haven't been in person since last year, right? Some of our kids are going back to school. No, it's face to face. And so we're there. The time has come, but we need to figure out how we're going to be the most safe, right? We need to make sure our kids are protected. We need to make sure people are getting vaccinated, right? We just had some really great information about the Pfizer vaccine. The FDA has approved this vaccine, which is great so more people are going to be able to get the vaccine. So we, again, just want to make sure that we're, answering some of these questions that we as healthcare professionals have thought of, and as well as our educators, and maybe even some of you as parents have questions, okay? So one of the things, just to kind of start our questions, and I think, Dr. Chandler, you answered a few of my questions already. And this is a biggie. And some of, I'll just put this out here on the platform. How safe is it for kids to go back to school when there is no universal masking. I don't know. Maybe some of our teachers can speak to what the requirements are for masking. You know, give us some of your input and what you think about that. Leslie.
Our district has made it mandatory for all staff, all student, all faculty, all guests, anyone who walks into their buildings to wear their masks. I, as a teacher dealing with busy seventh graders, I have to remind them to put their mask above, on their face properly, on their nose, covering their nose and their mouth. And of course, I do the same. The mask piece is difficult for me being a fine arts teacher, a performing arts teacher, where you have singers, you have actors, and our voices are hindered, our characters are hindered. And so there's even policies for performing artists to monitor themselves and, mask when you're off the stage, and then when you're on stage, and then when you're off stage, put your mask on. So your mask is off long enough for performance while on stage, but you get off that stage and that mask is on until you're back on again.
All right. Anybody else have anything they want to chime in? How safe do you guys feel is it for kids to go back to school? And what is your masking policy at some of the other schools that you're working?
Well,
So
go ahead.
Okay. Go ahead,
for our school, the math policy is the same. For me in my particular classrooms, well, I have several bells of students. Just like we have to educate adults, we have to educate the children. Help them to understand, don't sugarcoat it, but help them to understand that it is impacting their age group as well, how it impacts them. I even had a student to ask me, why don't we wear masks for other diseases? And so I had to explain the difference between airborne illnesses versus bloodborne illnesses, etc. So we have to make sure that we are vigilant about educating our children and not sugarcoating it for them.
Mm-hmm.
That's good, Yolanda. Valencia, what did you have to say?
Yeah, I just was going to add like some things that people should still be doing at school, like wiping down your tables. I have little kits on each of my tables so kids don't have to I'm kind of like OCD, I guess, but so they don't have to walk around. And I have like little garbage cans so nobody has to walk around. And and I make seating charts so I know where everyone is, so that if somebody is maybe has the tested positive, then I can contact trace, and they can. And so we have to inform those parents, that their kids were in close contact. So and they wear their mask. I just want to make sure my students understand, like some of them want to go into bad habits, try to come in and eat in your classroom. And I'm like, it's still COVID. You cannot eat in here. First of all, I don't want you eating in here, even if we didn't have COVID. But the fact that we do, you wipe your hands on the table, then you get your food and you put it in your mouth. And then they go, ugh, where the hand sanitizer? So like it's in the bucket. So, I just want them to keep thinking about like the precautions that you were taking before. Keep taking those, because like when I got vaccinated, I still wore my mask inside because that was just what I did, because so I think that all of our kids have to wear their masks no matter where they go. But like I know some sports teams, they're not practicing with their mask on. Like it's difficult to practice. And so, students are getting sick. Somebody might come in with it and then they have to cancel games, and then you have to quarantine, and then you have to find out who were they sitting next to when they were, so just make sure that the kids are wearing their mask and the teachers are wearing their mask. Everybody has to wear their mask, because sometimes because we had the vaccine, we think it's okay to just drop all the other safety things. And so I think that's something that we have to reiterate to parents, to students, and to everybody, so that they're still washing their hands, and things like that. So that's because I think that even with all those protocols, we didn't have a whole lot of flu last year, right? So when kids was coming, because so that helped, that kept that
That
down,
is true.
So,
that's a great observation, and you're so right. I do feel like with these times right now that we're in, it does require a lot of education, not just for the kids, not just for the children, but for the adults. And I see someone put in the chat that they have grown people that still have to be reminded to wear their mask correctly over their nose. And guys, we cannot be afraid to gently ask people, where's your mask? I know I do it, to grown students. And so it's like, where's your mask? That gentle reminder, because the thing about this variant, whether you're vaccinated or not, that's the thing, you said that key, whether you're vaccinated or not, we don't know what the variant can do. We don't know what the possibilities are. So whether if you've been vaccinated, even some people, again, it's still in the research, people who've had COVID previously, there's just so many unknowns for this Delta variant. And so I take it serious, and I've worked alongside of COVID patients face to face, of course, in the proper protective equipment. And I'm grateful. I did not contract COVID. I've always been very careful. I watch who I'm around. I still do that to this day. I'm just so grateful. I haven't had any symptoms. I've not even had any scares. And so, but that's because I've been very careful. I do feel like some people have let their guard down in some instances, and it may have cost them at some point. So we got to continue. We got to take it back to what we learned back in March, right? March of 2020. We got to go back to some of those very basics. And unfortunately, we're here, but it needs to happen. Go ahead, Leslie.
I was looking at, I think it says Yvette Williams. It says it could result in a domino effect. As teachers, and we're working with other people's children, and then we have to be mindful of who we have in our homes. Because I have someone in my house who got the first vaccine and had a very severe reaction, and they can't get the second vaccine. So, and she has settled with that, and she wears her mask everywhere. And so I have to be sensitive with who I'm around, simply because I affect other people, the domino effect. A parent may affect a child, the child may affect the teacher comes home, then they're affecting their husband's wife, and children. Those children don't know, or the husband don't know, he takes it to work, and then there's this domino effect.
Yeah, so we have seen that. I've seen entire families contract COVID. I mean, like 14 people in the whole family. And so we're back to that. So we're back to those COVID isolation. I remember when at the church, we took it all the way there immediately. And we haven't, we never let up, and again, grateful for that, swift movement, and thankful that leadership listened to us as we made those changes immediately. And so, but we're going to go ahead and continue, because this time goes fast, and I do appreciate everyone chiming in. I do have a question, and this is really affecting, or is related to the parents of our children. How should parents support their children during this unprecedented school year? Because the school year is here. They have to go back to school. We need them to get their education. Many students are behind. Last year was a blur, right? Some kids just really could not adjust with the way the virtual school setting was. And so a lot of kids got behind. And so for our parents, how can parents support their children during this unprecedented time? Anybody? All right, go ahead, Ms. Leslie.
We're going to work backwards. With high school students, we have to, especially those juniors and seniors, it would support them best if you teach them to hold themselves accountable because they're growing into adulthood. While it's a pandemic this time, it could be a natural disaster the next time. And so our teaching them what their responsibility is to safety, versus what a seventh grader's responsibility is to safety. So, for instance, with a seventh grader, they might be responsible for mask, and you got to remind them to hand sanitize. Well, with a high school student, they might have to learn how to make a routine and a schedule, or keeping small packs of hand sanitizer on their person. We wouldn't really encourage seventh graders to keep hand sanitizer because it becomes a toy at some point. Parents would be served best if they were allowed children to learn some specific routines, on hygiene and cleanliness with respect to keeping your hands washed, even sometimes random. You don't have to go to the bathroom to just so that just to wash your hands naturally after you would. Sometimes you just want to wash your hands. And water fountains, rather than drinking out of the water fountain, a water bottle to take to school in the backpack is definitely supportive, because at our school we're not using water bottles or water fountains. Mm-hmm. And so having that portable water bottle with a secure lid, so that they pop the lid, drink, and they snap it back, that definitely supports teachers, because the purchasing water can be costly. I'll do it because it's my class, but still, those things, teaching a routine and allowing a water bottle.
That's good. That's good. Anybody else want to chime in on that? Because I do have another question, and this is related to parents. Valencia, did you want to say something? We can move on.
Yeah, supporting. One thing that all parents can do, even if you have seniors, I know sometimes when they become seniors, we want to be hands off, but right now, especially with the pandemic, it's so important that you get into that building, you talk to that counselor, you find out where your kid is, and don't wait until March. Don't wait until May and say, I didn't know they were. And I mean, schools call and I know my school, we work really hard to make sure we keep our parents informed. But that to me is so important. Your juniors, your seniors, a lot of parents are in and they're on it with your younger kids. But when they become juniors and seniors, we think that they're, they should be able to handle it. No, they are really easily will turn off. I know I had kids who would mute their screen, act like they was there, and go do something else, and when they got back and they didn't know what we were doing, I was like, we did this every day. What's going on? So they, they not, when we were virtual, they're not on it. But I just would like to make sure parents of seniors, especially, to check that their kids are on track. And if they're not, find out what the school has to offer to help them get there, and then check in that they're, completing things, because you don't want it to be May and they're not going to graduate. And so that, for me, that's my biggest thing for parents. You really, I really would like to say you have much more power than you think. Don't be afraid to go to the school and ask questions, because your child is your responsibility, and don't get me wrong. I know myself, we work extremely hard to make sure kids graduate. But if parents are in there pushing their kids as well, they know that both of us are on them, instead of just maybe the teacher that they don't really care about. So parents and teachers, and even if some kids, you just ask them, hey, how you doing? Just try to, encourage them. And also the other thing, like based on like last week what we did, I want to make sure their mental health is so important. And check checking on them and just talking to them. That show was last week, but I want to make sure that's also talked about. But that for me, it's like those seniors, because a lot of times we think they got it and they're grown, and they might tell us they're doing it, but check on them anyway.
Yeah, and our senior students also need to make sure they're wearing their mask. And Felicia, I just want to apologize. I must have Valencia on my mind. It is no offense that I was calling you the wrong person, so I do apologize for that. Thank you so much.
That's okay. That's not.
Thank you. Yes, our seniors definitely need to make sure they need to be educated too. So sometimes that hands-off method for this pandemic, we need to put our hands on a little bit more as far as reminding them, because they're not invincible, and we're seeing that in our numbers. How can parents support teachers and school administrators during this time? What kind of support do you guys feel like you need as teachers related to this this time that we're in right now?
So my experience, some of my parents, sometimes COVID depression can manifest in behavior issues. Mm-hmm. And some parents, they're fighting the teacher tooth and nail. Must be you, because my child is not my child. But parents need to understand that they are impacted. Like, I've talked to my students about COVID being real. I've shared with them how COVID has impacted me, and that it has impacted all of us. It's changed the way we do things, to change the way we live our lives. And so parents need to understand that it may be more to what's going on. And so that looks like help for me, so that if we're talking and we're having conversations, they're not just automatically, it's the school, it's the kids picking with my kid, etc. But to understand that there may be some mental health things going on as well.
Yes, that's good. Mental health. We can't get away from mental health. Mental health for the kids, the parents, the teachers. We're facing a lot. Mental health. I know in the primary care setting, when I'm working in my clinicals, we see it a lot. Even some of my adolescents coming through. Mental health is just, it's a big time for mental health issues. And so really parents paying attention even to that, those symptoms that some of their kids might be exhibiting, we need to figure it out. Do they need to go make an appointment with their pediatrician? Maybe they need to talk to someone. But, we know that they have lost a lot of ground as far as that virtual setting. And we know that, they didn't really get a lot of socialization skills. And we know that, a lot of our children are behind. But our parents, we don't, that take your hand off approach. It doesn't work for all kids. And we need for the parents to get back to some, like I said, some of those basics. I see some people in the chat here, making sure their children are doing what they're supposed to do when they're in school. And that's what parents should do. Parents should be supportive of the teacher. If their children, you're getting a note or a letter or a call that the children are really giving the teachers a hard time about wearing their mask, we need to talk about some consequences for kids who don't want to wear their mask in school, And so one of my questions, and this is just kind of off of my list of questions here, do the children receive mask breaks in school? Do they have an opportunity? Because I know with me lecturing, even in the healthcare setting, working with patients, sometimes I have to excuse myself to get some fresh air, to take the mask off. I'm thinking about for children, they're in the mask all day. There are going to be some some behavior issues, people feeling hot. Some of the kids, they're probably hungry. They didn't go to bed on time. What are the mask breaks looking like? Do you guys have that, or are you giving those kids the breaks from the mask?
For my class, being that it's a performing arts situation, I do have a section where a student can sit over by themselves for a few minutes, not a long time, to get a breather, because those masks do hold in moisture and they do get hot. And so you have that heat and your moisture and a mask plastered to your face. It could be really, really challenging. But there's one piece that I wanted to say regarding parents, if I may, real fast, find a trusted teacher of your students' list. Yes, your student may have 5 to 7 teachers on their schedule, but there's always going to be that one teacher that you connect with that will be able to strongly advocate for you when your student is having a challenge. Just like we encourage students to find a trusted adult in the building in the event they have conflict, or even if they need a self-care break. Parents, find a trusted teacher or adult in your along your student's schedule so that you can reach out to them for anything. And you'll find that you'll have that triangle, the teacher, the student, and the parent fully covered. Because when one part of that triangle is missing, the student has a hard time meeting goals towards graduation in the academic setting.
Yeah, just like Felicia said, don't wait till March and May. And that's really, really good. Actually, I think I saw somebody asked about the quality of the mask. That's a great question. Has the quality of the mask since this Delta variant, has it changed? I don't think the quality of the mask has changed. What do you have to say about that, Dr. Chandler?
Yeah, so the quality of the mask haven't changed. So we do know that surgical masks work well. If you can't get surgical masks, then we're still recommending, the CDC is still recommending, face coverings. Of course, if it can be layered face coverings, that's most protective, right? You have multiple layers in front of you, but most surgical masks are three layers, 3-ply mask. And then I know there's some like KN95 masks that people wear, which are like 4 layers. So the mask quality has not changed. We're still recommending the same type of mask that was the original COVID variant with this variant too. What is different in recommending now is that we're recommending people get vaccinated, right? So we do know that the vaccines work. They are safe. They are effective. The goal of the vaccine is to, of course, we want to prevent infection, but most of all, what the goal of the vaccine is to prevent hospitalization, severe infection, and death. And we know that it does all 3 of those, right? As you look across the country, we see people, the most people that are in hospitals are the unvaccinated. So it's really important that, we're getting vaccinated, especially for adolescents who the vaccine Pfizer has an emergency use authorization for 12 to 16-year-olds. So that age group can get vaccinated. So middle school and high schoolers can get vaccinated. And every day in my clinic, I'm recommending to my teen patients and their parents to get vaccinated. I think I'm glad to hear that schools are mandating universal masking, because we do know that the younger age group, the 5 to 11-year-olds cannot get vaccinated, right? So masking plus vaccination works. The way out of this pandemic, though, is vaccination. The reason we see more variants is because people are not vaccinated. So the virus has to figure out a way to survive. It does that by people who are unvaccinated and being able to mutate. So the more people are vaccinated, the quicker the virus would die out. So I just want to drive that home, that masks are highly important right now because not enough people are vaccinated, but vaccination is the way out of this.
That's right. I definitely was going to give my spiel on the vaccine because, again, we're back to that. We have some awesome questions over here in our chat. One of the questions is somebody has a question as far as how long does this virus stay in the air, per se? That's Miss Linda's question. How long can the virus stay in the air?
So I would have to look up the exact time frame. I'm not sure right at the top of my head, but we do know that, when you sneeze, air particles linger. When you talk, air particles linger in the air. So that's why we want you to wear masks, right? Because those masks prevent from air particles coming out of your mouth and then hitting someone else's mouth. And when everyone's wearing a mask, we're protecting ourselves and protecting each other. I would have to look up the numbers of the exact time frame, but we know particles last in the air for a while.
So long enough is what I say.
Right.
Long enough. So again, getting back to the mandates. You're hearing various companies, hospital employees being mandated to get this COVID vaccine. by October 1st, I think. Is it some places I'm hearing they were giving them until December 1st. And so there's a little variance in the dates. However, it is a mandate. Actually, employees are like, walking out and going on strike and, saying that, it's against their rights or whatever. So there's a question here that's asking about teachers. Should teachers be mandated to get vaccinated? I don't know. I'll leave that up to you.
I know CPS has been debating it, like discussing it. But I think I heard like 90% of the teachers are vaccinated in Cincinnati Public. I have to look it up again, but I think that I heard that. And they gave, an incentives as far as your health care, extra money on your health care card when they first started. I know the day I saw on the news they were giving not to teachers, but to anybody for their first $100 gift cards now to get people, since the Pfizer has been approved. And so that's why you're seeing all these mandates. CPS hasn't said whether or not, and I don't think there's any districts in this that have actually mandated it, but everybody is highly encouraging it, even up to the governor. I know today somebody was trying, I think it was a hospital, they were talking about some of the healthcare workers not wanting to do it, and he was like, that's a wrong call. We need to make sure everybody is getting vaccinated. So
yes, that absolutely. And as a healthcare worker myself, like as soon as it was available, I didn't have any qualms about it. I knew that was the direction, especially working in such close proximity with these patients. And the mask work, obviously, look at me again, the mask work, the vaccine has protected me. I'm not a zombie. I didn't turn into a zombie. I didn't turn into a zombie. I'm good. Again, I think it's just that misinformation that people have. There's all types of sayings that I'm hearing. Myths is what we call them, misinformation. And for people to know that it's okay to get this vaccine because we've come so far. We have come so far. We want to live normal lives. We want that normalcy back, right? I miss hanging out with some of my friends. I love entertaining and hanging out with family and friends. But I have to be the most safe for me, for my mom, for older people in my family. I miss it all. However, I'm going to be the safest that I need to be because I want to live, right? I want to live. And so our numbers for the vaccine is still low amongst our population, people of color. We still are not up there. We're just not getting there. I know I did a push. I think it was in November, maybe. I did I was in an interview, it was a local news station, and it was my plea for us, as people of color, get this vaccine. We came up just a tad bit, but we're not where we need to be. But I do know communities are pushing it. I think I saw an ad. I'm thinking it's this weekend. They're going to have like shots available in the barbershops on Saturdays. Again, what a great testament as to how very important this vaccine is for our communities. And so that's what we need to see, right? That's what we need to see.
Stephanie, if I can just add to what you're saying. So personally, as a pediatrician, I do think teachers, this is my personal opinion, should get vaccinated, and it should be mandated because you're working with some of our most vulnerable and precious commodities, right? Our children, and our 5 to 11-year-olds can't get vaccinated. And so until they can get vaccinated, I think it's important for teachers and people who are working with students to get vaccinated. Of course, like I said before, I think it's important for adolescents who are able to get vaccinated, and parents and everyone who's able to do that. But teachers should get vaccinated. Physicians should get vaccinated. Healthcare workers should get vaccinated. So I think people who are working with people who are vulnerable should definitely be vaccinated.
Absolutely. I am in full agreement with that as well. Absolutely. There's a question from Guy here. Does the cloth mask work as well? Facial coverings. Yes, absolutely. Cover your face, cover your mouth, cover your nose, right? And absolutely. I would say yes, that it is effective.
Yeah, and I agree. I think Linda makes a great point, making sure that you're not touching the outside of your mask, of course, because when you're in public places, that's where particles are landing. So making sure when you're taking off your mask, before you take it off, that you sanitize your hand. You take it off by the ears, not by the front. And same thing when you're putting it on, you're sanitizing your hands before you put it on. You're putting it on by the ears, not touching the front of the mask, and making sure it's close to your nose and covering both your nose and your mouth. A mask does not work if it's just covering your mouth or if it's just covering your nose. It needs to cover your nose and your mouth.
Yeah, I was in one of the grocery stores. I won't even say the chain because we are on Facebook Live. And I had to educate some of the young folks. Pull that mask up. Do you know you're working in the grocery store, right? And pull up the mask. And so I often say it. Where's your mask? Where's your mask? And it's okay to wear your mask. It's not uncool to wear your mask. Yvette Williams, yes, people of color are non-trusting and think that most things are created to cause them harm. That is so real. That's some real stuff. And I teach my nursing students that. We see that there's such a mistrust of people of color. And they just don't trust, healthcare professionals, no matter what color they are. They don't trust the government. They don't trust, they're just not trusting. And so that I've heard that been said that they're, one of my patients at the clinic said, I heard they put a tracker in you if you get the vaccine. And I'm like, that's misinformation. That's misinformation. It looks like we have another vaccine. Dr. Emmanuel, can you address that? Can you use any of the booster shots with any of the vaccines? All the vaccines, I don't think they have boosters yet.
Right. So they're looking at boosters for Moderna and Pfizer, which are the mRNA vaccines. And right now, what's been approved is when they approve boosters for the general population, because they have approved a third shot for immunocompromised. Yeah. And there's a difference between booster and a third shot. So this third shot is being given because the immunocompromised did not actually mount a true immune response to the first two shots. So I know the media calls everything a booster, but for the immunocompromised, it's a third shot. For us who are immunocompetent, meaning that our immune systems work well, it would be a booster. And when they approve boosters, it will be I think the idea right now is that you would have to get if you had Pfizer before, you would get a Pfizer booster. If you have Moderna, you would get a Moderna booster. There are some studies looking at, can you mix shots? Right now, I know there's a study at Emory University they're looking at that. So there could be some down the road possibilities of being able to mix vaccines, but right now you'll have to stick with whatever shot you got before.
Right. Yeah, and I think I saw too right before we got on here. I read something about maybe potentially the Johnson & Johnson, the vaccine, and that was only one vaccine, and possibly having a second shot or a potential, I guess, booster available to raise those numbers of immunity. Because as we know with the Johnson & Johnson vaccine, that level of immunity is just a little lower than with the Moderna and Pfizer. So I did read that, which is great news. It's awesome news. All right. So does anyone else, what I want to just say here, for the parents, I just really want to encourage the parents of particularly our older students, especially like our middle school on through graduation. And I think Felicia said this, just to stay with their children academically, emotionally, socially, spiritually, and, helping them to continue to plan for their future. Because I think we have gotten away from that so much just because we've been stuck in the house. We're not doing things the way we normally have done them in the past. I think we've gotten away from some of that focus that our kids can be great. They can still set have a future, and they can still set goals, right? Professional goals. And so we want to encourage our parents to still push our kids to be the greatest that they can be. But it's going to take, like Miss Leslie said, it's going to take building those bonds with your teachers. Getting, being able to have that open lines of communication with the teachers, the administrators, working together to make sure our kids are successful this school year. And so I think we all can do it. Does anyone else want to just chime in to kind of give their little spiel as we're getting close? This went so fast, but we're doing a great job. It's been excellent. Anybody else want to give just kind of their little closeout?
I do. There's been some discussion about our children being behind because of the pandemic. And so what I'd like to do is encourage the parents to utilize resources that are out there because the digital divide is real. It's a major, major issue. A lot of our students don't know how to log in, and a lot of our parents don't know how to do it either. So as your schools, communities, churches, etc., are making resources available for you to become educated, please take advantage of it because it can help you. And if our numbers keep spreading the way that they're spreading, I'm pretty sure we're going to be virtual again. And so we don't want to repeat what we had before, where we had so many children not engaging in their education because of intimidation of the technology.
Yes, you are so, that is great. Any of the other teachers here, what do you guys
what
would you like to say?
Yeah, great point, Leslie, Yolanda. Also, like I was saying before, there are like the district, several districts that had extra things that kids could do. So whenever you see some programs that they're providing, go ahead, and it's nothing wrong with doing that. Just send your kids. Like a lot of parents sent their kids because they wanted to get them out, which is okay because they got that extra learning, summer learning. And one thing I want people to remember is that your kids learn to survive a pandemic. So they actually learn some things. So it's don't be like I don't want you to feel negative or down on them or down on yourself. Just give yourself some grace. And kids give yourself some grace and give your parents some grace, give the teachers some grace, and just let's try to work together. And because our kids are great, they can do anything they want, but they have to remember that everybody was in a pandemic. Like you can't go to college and say I had to be online everybody had to do this. So do what you have to do to set yourself apart. And everything is still out there for you. You can reach your goals. So just stay positive. If you need help, ask. Like if you don't see people offering things, ask your administrator.
Most schools,
ask the teacher that I'm sorry, I'm going to be quiet.
No, you're fine. I think your connection was kind of fading, but thank you so much for that.
Okay.
Those words, Yolanda and Felicia. Go ahead, Miss Leslie.
Most schools have a resource coordinator, and those resource coordinators help connect families with services outside of the academic instructional setting. So be it social services like mental health, medical and dental, extracurricular activities that take place after school outside of sports. If there's life situations where living is a challenge, resource coordinators at each school should be able to assist you and direct you to the sources that you need. So I know with our district, it's like the schools are community learning centers. So you're not just sending your student to a school, you're sending them to a community where they can have provisions outside of the academic setting. And we all work cohesively in the best interest of students in a trauma-sensitive and social emotional learning setting. So your student is number one in our district. Sometimes you may not feel like it with those tough teachers who are strictly by the book, who have a challenge with extended mercy. But in the end, where you have that trusted teacher, that trusted adult in that building, 9 times out of 10, I really hate that quote, but you're always going to be directed to your resource coordinator for social services outside of the classroom.
Thank you so much, teachers. You have given some awesome advice. I do want to go back to Miss Linda had a little saying on here, a little suggestion. and this is great, and I'm coming from an adult practitioner perspective. If parents need help with their depression, a lot of parents have been dealing with their own depressions, their own mental health issues. It really has been hard for them to even consider what's going on with the children. You have homework? Well, they're not even there mentally. So if a parent is having some issues with their mental health, they do need to seek help. That is so very important, because a lot of times our parents are, in some of the parent home settings, they're running the house as a single parent. And so not all the time, but sometimes that's the case. And they hold the entire family together. They run that whole house. And so if the head of the house is mentally off balance, there's going to be some issues, right? And so we want our kids to be successful. We want them to have a great school year and be safe out there, right? So this has been, does anyone else have any other questions or anything like that?
Yeah, I'll just add to what all the great things that everyone just said. I do agree 100% to making sure that we're just checking in with one another, both parents checking in with your kids checking in with your parents, grandparents checking in with your grandkids and your children who are raising kids, because I think we're all in this together. We've been in a pandemic for 18 months, right? And it's taken a toll on everyone, mentally, spiritually, physically. So making sure that we're checking in with one another. And I think the most important thing that we can do to keep kids in school, once again, is making sure they're masking, get vaccinated. I'll say it again, please get vaccinated, but wear your mask. And then teachers, schools are already doing other mitigation techniques such as physical distancing, cleaning, all those great things that they already talked about. So I think what parents can do on their part to keep their kids healthy is masking and vaccination.
You're right. Yes, that's great, Dr. Chandler. And I know I have some friends that are teachers. And so just to hear how so very creative they have been in their classrooms. I mean, teachers were ready for fall. They were going, actually, it's not fall yet, but to prepare for the fall school year, the new school year, they were going into the classrooms, cleaning the rooms. I know you, Miss Christian, I saw that you had just changed your whole classroom environment to make it a softer environment for the children, to make that area more inviting and just give them a safe haven that it's okay to come back. It's okay to be in this setting with your mask on. This is what we have to work with. Let's do it in the most effective way. So kudos to all of the teachers on the platform. You guys we need you. We need you for our children. We do. And we just applaud you all for everything that you're doing, and you're doing it boldly, right? I know all of you are believers, and I am so grateful for everything that you're doing for our kids. I really would like to say all my children are grown, and I'm so grateful for that. I always think, what would I be doing if I had 3 small kids, sometimes 6? If I was doing my foster parenting, what would I be doing right now with all of them during this time? I just can't imagine. So also to you parents, my hat goes off to you all, because you really had to make some really some sacrifices and some big changes in making sure that the children got to school safe, and that they got to school with clean clothes and uniforms and stuff like that. So we applaud you as parents as well. Okay, we can beat this, guys, and we can overcome all of this that we're going through right now. Get vaccinated, stay healthy, and stay smart. Yes, Leslie, do you have something to say?
Yeah, just one final thing. If parents can extend a little compassion and mercy to teachers, because we have students coming to our classrooms from every direction. Mm-hmm. And then if you're a high school teacher, not just every direction, 7 bells a day, different students each day. So there's those dynamics that we deal with, and we have our own mental health that we really are keen to, so that we can best support your children in our classroom. So when we call, it would help is if you're upset, just take a quick breath before you download, and then we can get done what you seek needed for your child.
Absolutely. Absolutely. All right. I think I'm gonna see. Is there any other questions? I don't think there's anything else in the chat. Looks like Pastor Carol is rejoining us as we're ready to close out. I think this was an awesome discussion, and definitely warrants. We just need to talk about it. This is real life, and we are right in the midst of survival mode in our schools, and we have to be there for our children, right?
Yvette Williams had a nice final moment. It says, and keep your children home if they're not feeling well. Thank you.
Please.
Thank you. And also thank you for saying that.
Yes. Thank you so very, very much. You all are tremendous. I made a note to myself, and I've said it before, that this information that has been given is equal to any national news that you will have gotten on any cable station, network station. This is equal to, as I said, we have our own doctorate, our own medical team, and our dedicated educators. And so this has just been absolutely tremendous. This is not an overkill. As Dr. Chandler opened up, we've been going through this for about 18 years. I mean, 18 months. I'm sorry.
Feels like 18.
Feels like it for 18 months. And we did think that we could breathe and we could relax. And then we're starting all over again. So use the same protocol as we did from the very beginning. It won't hurt us to go back to the beginning, careful who we're around, where we are, going to a grocery store at a time of day that isn't so crowded. Don't go on a Sunday afternoon. Just really map out your life to keep yourself safe. So continue with all the protocol. This mental health issue just continues to come up in the last session that we had about mental health. So seek out some help if you can. They even have online help. You know, I don't have the money to find a psychiatrist. They even have online help. And I was reading an article the other day that said, if you just have a good friend who can listen to you, that is, it's good for the brain just to have somebody to listen to you. And as Stephanie has said, we're not powerless. There are things that we can do. We are not, and the news will sometimes make us feel we listen to the thousands of people who have died, but we are not powerless. Not only can we make some intelligent decisions to protect ourselves and our children, but we have the power of God. We have prayer, and we can't get a better advocate for taking care of us after all than to really, really pray. So I thank you so very much. We are in unprecedented times. There are times when we, as older adults, don't know what to tell other people because we haven't lived that. This has been 100 years ago than anything like this. So nobody living knows what to do. Not really. So I encourage you of older students, especially as they go into their junior and their senior year, we are releasing them into a very strange world. It's not even anything that we have known. So love, unconditional love, unfailing love from God, listening as much as you can. Seniors are about to be released into a very strange world. But if we've got love, if we've got God, if they have good thinking skills, problem solving skills, that no matter what they come into, they're going to be able to think through some things and getting them as independently as possible and problem solving. So share with someone else, please. Send this broadcast to someone else. We really, really need to be as informed as possible. We cannot continue to be the least to get informed, the least to get vaccinated. We don't have to be the least. We just don't. Again, God bless you all. God bless the panelists, Yolanda, Felicia, Leslie, Dr. Chandler, and Dr. Stephanie Bolden. Thank you so much. I mean, you got doctors all over the place. You've got 30 years experience out of Felicia. You've got a newbie that Yolanda actually is enjoying teaching. Leslie, you've been working with young people in dance and creativity for a long time. Dr. Chandler, you're known throughout here in Cincinnati. Stephanie's so proud of what you have continued to do and speak well of your profession. Thank you all.
Thank you.
Be blessed, everyone in the audience. And if you will stay in the green room, I
thank
appreciate
you so much, everyone. Thank you.
Good night.
Good night. Good night. Bye.
Good night.